I'm a pediatric neurologist at Children's Hospital of Michigan. I specialize in a couple areas within child neurology, one of those being traumatic brain injuries such as concussion. I'm a medical director of the Concussion Center at Children's Hospital of Michigan. Well, the adage that we come up with in our specialties within the umbrella of pediatrics is that children are not just little adults. They have very unique needs. They are constantly changing and developing, both in their abilities, but also actually at the basic level of their nervous system. It's still continuously evolving through up until young adulthood. Most were sports related, but we would have different types of sports, and not always contact sports. There's a lot of incidental contact during other sports, especially things like soccer, cheer, gymnastics. So we're traditionally not thought to be, either male dominated or contact. So there is higher rates in those. But we see a lot of non-sports related concussions due to accidents, either due to a motor vehicle accident or someone having a fall or some other unusual circumstances sometimes. The symptoms of concussion usually show up pretty quick. Some of them may show up immediately. Obviously, one of the easiest ways to diagnose someone with concussion if they get some type of trauma or hit in the head and they lose consciousness, right? They're not just passing out, they're actually being knocked unconscious. That's kind of relatively easy, but sometimes it can be more subtle to that, including non-specific signs like headache or dizziness, maybe a little bit confused or looking dazed and not responding as quickly. Some kids will report, having some difficulty with their vision, blurred vision, or saying for a few seconds they weren't able to see. Anything that can create a very temporary or transient neurological symptom, right? These symptoms for most usually show up within 6 hours, but some can be as delayed as 24 hours. If they're playing a sport or doing an activity, they should be pulled right away, even if it's suspected. It doesn't have to be confirmed. Just because there can be some issues if you continue to do an activity and get hit again, it can cause a lot of very significant symptoms if not careful. Nowadays, we're not necessarily having children stay awake. One of the kind of things that the brain wants to do is rest to start, its healing process. So, and it being very in a dysfunctional state, it's going to want to go to sleep. So, the concern is, not knowing if there's any changes in their level of alertness, right, when they are awake. So usually we let children sleep, maybe checking on them once, but again, there's no hard fast rule that the child actually needs to be checked. Having some of the what we call red flag symptoms, such as they're not coming back to their usual self, like they're not responding appropriately. They're having very significant symptoms such as nausea, vomiting, severe headache, any persistent focal symptom like weakness. They should be probably brought right away to an urgent high acuity area like an emergency department or urgent care. If they're suffering from lower degree of symptoms such as feeling mentally foggy, difficulty focusing, headaches without vomiting, or any change in those type of symptoms, then probably following up with their pediatrician within the next day or two is probably most appropriate. Persistent symptoms, not explained by something else. If they've had a history of previous medical or mood symptoms, that can sometimes are often amplified and more persistent than average. If there is any unusual features or suspected that there may be other underlying problems going on, then definitely referred. Or when a primary care doctor is looking for additional input for maybe a challenging case or just a kind of a backup to make sure everything is being managed as well as it can be. I think it's important that families are confident in the treatment that they're getting. that they have full access to all the specialists that may be needed. Our clinic is specifically designed as a multidisciplinary clinic involving neuropsychology, physical medicine, rehabilitation, and neurology, as well as our ancillary services in physical and occupational therapy and other psychological services. So having a reputable group of clinicians and resources, including our nursing coordinators and other support staff, really kind of make sure that a child is getting the appropriate attention and access to resources that would best help them recover from these type of injuries.